Is this you, Suzanne, or is that Kay?
It's me.
I'm proud of myself. I think it seemed like I joined the correct link. What are the odds that everyone else will?
Mm, doubtful.
That's all right. Definitely just keep an eye out though, Suzanne, in case anyone does accidentally join as an attendee.
Yep. I got my eyes on the list of attendees right now.
Hello, Steve.
Hi there. How'd we happen to set the next meeting on May 12th?
You know why? Because the day it should be is town meeting, I
Okay,
believe. May 5th, right?
that's Cinco de Mayo, but I don't know
I
about
think,
town meeting.
I think it's town meeting. Town meeting is May 5th. I just looked.
Did you go home?
Yes, I did. Okay.
Hi there. Oh,
Looks
is-
like you guys both got into the Zoom okay, it looks like.
Seamless.
That's great.
Over Board of Health is Suzanne, right?
Yep.
Hello,
See, there's proof.
Hi, Suzanne.
how are you?
Good, how are you?
Good.
Well, I would say your minutes continue to be amazing.
Oh, thank you. I'm glad to hear that.
Does it take hours and hours or not? I know you've said,
Yeah, just I split it up throughout like the days when there's not something for me to work on. That's usually when I'll plug away at it. So,
Mhm.
and then sometimes when there's not people waiting to talk in here, I'm able to do it while we're as the meeting's going along. So,
Mhm.
It's a tough task, but Suzanne does a really good job with them.
Yeah,
As you guys may or may not know, this group likes to talk a lot. So there's a lot of stuff for her to sift through.
we don't talk nearly as much as we used to, right, Steve?
Well, we're missing a premier talker.
There is the cat.
Cat?
Didn't I just see the cat?
You did. Cat.
It's beautiful. I'm fascinated by cats, but I'm allergic to them, so I could never have one, but
Oh, such a shame. I had a neighbor who was very close to Margot and really wanted to be able to come into our house. So she spent a year trying to get desensitized in an allergist's office to her severe allergy. And it didn't work. She spent a fortune on it out of her own pocket. So
it's a shame.
hopefully your grandkids won't be too fond of them.
Yeah, no kidding.
It's 6:31.
Why don't we give him another minute or two? And I actually have to run and do one quick thing. I'll be right back. So no John yet? No, I'm not missing it. Oh, wait a minute. He is here. Yes. Hi, John.
Hello. Sorry about that.
It's all right. Should we get started?
Please.
Uh, let's call the meeting to order. Kay Peterson, Chair, present.
Stephen Kruskal, member, present.
John Quackenbush, also a member, also present.
And Suzanne, do we have any visitors?
yes, it looks like we have quite a few attendees. There's 10 people that have joined us.
So,
So okay, if I may jump in and just give a recommendation here.
yeah,
Why don't we at this point, if anyone has a public comment other than the tobacco item, since I know most of these folks are here for that agenda item, If anyone is here for any other reason, if you could please raise your hand just for public comment. If it is something related to the tobacco item, we're going to get right into that. So if you could just hang tight for 1 second.
Are there any names you recognize as being potentially non-tobacco attendees?
Not that I know of, but I do recognize a lot of the names from past meetings and emails from the past couple weeks. So,
Okay,
and I'm not seeing any raised hands, so I'm gonna assume that everyone is here for tobacco.
okay. And if they're not, they can just listen and whatever. So I think we should begin by hearing comments from people who are attending the meeting as attendees and not panelists. The board members will discuss the topic after the comments have been made. Could you all raise your hands if you want to speak, and Suzanne will try to take you in the order in which you raise your hand.
And when you raise your hand, I'll send you an invitation to be a panelist, and then once you're done speaking, I will put you back as an attendee. So first we have Peter Brennan.
Peter, are you there?
I am.
Okay, good.
Hey, good evening. Good to see everybody again. Name is Peter Brennan, New England Convenience Store Energy Marketers Association. And just as a reminder, we represent the interests of the 8,800 convenience stores throughout New England, over 4,200 in Massachusetts alone, and I think one, maybe two in Dover. So not a huge retail footprint, but we do deliver, essential goods, services to the community, provide you with all of your convenient needs. And we are against the nicotine-free generation proposal. I've submitted written testimony. I've spoken before the board previously on this. Nothing about our testimony has changed. This is really just a solution dreamed up by the advocates in search of a problem. Nicotine usage rates are at all-time lows, especially cigarettes, which have been on the decline for several years, are at record lows amongst kids and adults. Youth nicotine consumption is at an all-time low. So really, we've seen that education has worked. What hasn't worked is bans, because if you look at the flavor ban, which was enacted in Massachusetts in 2020, that has not put a significant dent even in flavored products coming into the state. People have just gone to primarily New Hampshire, perhaps they've gone online, perhaps they've gone to Rhode Island, Connecticut. So you see that banning products doesn't work, education does. I'd caution that, while you have very few retailers, you really don't need to target these retailers with a policy like this, because they already check IDs. This is not a youth smoking, a youth nicotine usage proposal. This targets adults. This only targets people that are over 21. So at some point, 21-year-olds should be able to make their own choices. If they choose to consume nicotine, they should be able to purchase it at a store that's going to check IDs, scan IDs, going to make sure that only legal adults are buying the products. And if not, then these products are going to be available on the illicit market. If you look at the recent news that seizures of illegal vapes were up 21,000% in Massachusetts, that's because we created an illegal market when we banned flavors. So now the last thing that anybody wants is illegal Chinese vapes coming into our communities, but we've created that monster and now we have to deal with it. So I would caution that, the advocates are going to tell you this is a great policy, it's going to stop youth smoking. I would say that youths are already not really smoking. Very few are using any nicotine products. And for those that are, then that's why you need education. That's why you need parental supervision. That's why the messages that have gotten out over the past several years, educational efforts have been working. There's no reason to ban something and create an illicit market where none currently exists. So I'm happy to take your questions. And that's all I have. I've, again, submitted written testimony. Spoke to you a few times. Happy to come back anytime you'll have me.
I have a question for you, Peter. Do you
Sure.
have any documentation about what you say is an increase in seizures of illicit nicotine products? Do you have any?
Yes, I
anything
do.
written
I
about that?
think,
Could you send that to us?
did I send? Let me see what I had sent previously, because there was a recent. Oh no, I didn't include it. Yeah, I can shoot that over right now.
So-
Yeah, I mean, it's well documented. It's in, if you look at the, it's not just, we didn't go seek this information out. This is in the Illegal Tobacco Task Force report. It's a report that's issued every year. So I can send you that report, I can send you the stats, and I can send you some media coverage associated with that report as well.
You have Jason's email address, right? You could send it
I
to
believe
him.
I have everybody's.
All right.
Yeah, I was gonna say though, okay, Peter, if it's, I know we've exchanged a few emails, so if it's easier to just send to me so I can distribute that, whatever's easiest for you, it doesn't matter.
Sure.
Why don't you do that, Peter? Because I don't know, some of the email addresses people are getting wrong and things are going places they're not necessarily getting to the people you want them to go to. So I think you should send your correspondence to Jason and he'll send it out to the rest of us.
Okay, so I just forwarded to Jason as well as the other email addresses that I had for board members. If those are incorrect, then Jason, could you please forward? And if you're looking for anything else, I'd be happy to send that as well. Oh yeah, I got a bounce back from 3 email addresses. So
Well, don't worry about it. Just
I think
launch it.
Jason's went through though, so
Just send it. It's simpler to send it to Jason.
absolutely.
Any board members have other questions for Peter?
No, thank you, Peter.
Thank you.
Thanks, Peter.
Thanks, Peter. Good to see you again.
All right, speaking
Hi.
next is Stephen Helfer, sorry.
I did, by the way, guys, while Steven's getting set up here, I already received that and forwarded it to the 3 of you, so.
Thank you.
I'm tuning in. Have you got me now?
Yes, we can see and hear you.
Thank you. My name is Stephen Helfer, and I represent Cambridge Citizens for Smokers' Rights. We receive no funding from any source whatsoever. On September 5th of last year, the FDA reported that teen smoking is at a 25-year low, and teen vaping is at a 10-year low. On January 16 of this year, the FDA announced that after, quote, extensive scientific review, end of quote, it was authorizing 20 different types of Zyn nicotine pouches, and that teen pouch use, quote, remains low, end of quote. If the tobacco industry is trying to attract youth, it is not succeeding. Teens are not using these products, and retailers are steeply fined if they sell to persons under 21. These proposed restrictions do not, in fact, affect youth at all, but limit the freedom of adults 21 and over. Adults in Massachusetts are considered competent to use their own judgment regarding alcohol and marijuana, both intoxicants. Shouldn't they be considered competent to decide for themselves whether they wish to purchase a nicotine or tobacco product, both of which, rather than intoxicate, enhance cognition and improve motor skills such as driving? I'm not sure what the situation is in Dover, but on this end of the state, almost all of the stores selling tobacco and nicotine products are owned by immigrants of color. Increasing restrictions on their businesses may not force them to close, but it would hurt and devalue them. Please do not impose new tobacco and nicotine restrictions. Thank you.
Are there any questions members of the board have?
None from me. Thank you, Stephen.
Thank you.
Thank you. Thank you for speaking.
Up next, we have Zachary Rich.
Hello, my name is Zachary Rich. I am a resident of Newton and talking to you today to invite you to support nicotine-free generation policy. I'm a pulmonary and critical care doctor that works at Boston Medical Center. I make my living by treating people with tobacco-induced diseases, whether that's patients with COPD or in the ICU. And this is how I'm going to pay my mortgage. This is how I'm going to pay for my kids' education. But ultimately, I know that one of the most important things I can do to help people is by trying to pass nicotine-free generation legislation. We've heard a little bit about this idea of nicotine-free generation imposing on people's personal freedom, and wanted to speak to that. I see patients with advanced lung disease, and almost all of them say, I am embarrassed that I can't quit smoking. I wish I had never started. I started when I was a teenager. And this idea of not having the freedom, the personal freedom to be off of cigarettes is really what sticks with me. That all of my patients, again, almost all of my patients started as youths, and almost all of them as adults then regret it, and now are seriously impacted both from a health standpoint, but also from a mental health standpoint of feeling embarrassed that there is something that they cannot do and give up this very difficult to control addiction, which is nicotine. We also heard about the black market that concerns with this legislation, and I think those concerns are reasonable to talk about, but perhaps might be overblown. Part of this is, again, I think the real beauty of this legislation is anyone who currently can buy tobacco products will forever be able to buy tobacco products. And it's only those that cannot currently buy tobacco products that would be creating that black market. And we know that if you do not start smoking as a youth, the chances of you becoming a 45-year-old and saying, hey, today's the day I want to start smoking, that really does not exist. That is a statistical anomaly we do not see. So I'm happy to talk any more about this, but I would invite you to consider passing this legislation as a resident of Massachusetts, as a physician, and as a parent. Thank you very much.
I have a question for you. You're a resident of Newton, is that correct?
Yes. Yep.
And Newton has passed a tobacco-free generation regulation, is that correct?
Correct. Yes. Yep. Yep. Yep.
And how long ago were you involved enough in that to be able to talk about that a little bit?
Yep. So I was involved with that, very similar to this meeting. Newton, we brought it up as saying, hey, let's consider passing this starting in January 1st of 2026. That way it keeps the math a little bit easier for having a line deciding when to start it. Newton completely on their own initiative decided we want this to start much sooner. We don't want to have there be another year of participants that are exposed to the potentially deadly effects of nicotine. And they actually bumped up the initiation date to be March 1st of 2025. So it is currently in effect in Newton.
And does your Board of Health do any surveys of Newton youth about smoking?
I'm sure they do. I might not be the best person to talk to about that. But I know we do have a youth contingency and youth involvement. I just came from a very similar meeting with Natick where we had a large youth presence. And I think this is one of the interesting issues where across the board, the youth that I talk to are largely in favor of this. They recognize the benefits of this legislation. And the adult smokers that I talk to are largely in favor of this legislation. No one ever has a response to what age would you want your kid to start smoking. But I'd be happy to follow up with any of those specifics if that would be helpful for you.
Steve and John, do you have questions?
Nope.
No, that was very helpful, Zachary. Thank you and your companion there for
I'm
taking
sorry, I
time
tried
speak with us.
there's other things I would rather be doing right now in full disclosure, but I feel this is so important that I wanted to do it any way I could. So
Well, it's nice to see him. So thank you.
Thank you very much, Zachary.
Up next, we have Emily Wyja. Sorry if I mispronounced that.
It might be Ouija. Is it Ouija?
Yeah, it's a Ouija. Thank you. Yeah, my name is Emily Ouija, and I live in Cambridge, Mass. And I'm a private citizen with no affiliation. And I'm just really concerned about adult agency and liberty. And that's why I'm so vehemently opposed to this generational tobacco and nicotine ban. I spoke to the board previously, and I've emailed my testimony as well. But I just wanted to speak up again and give my perspective. In my opinion, all you really need to consider here is that the age to buy tobacco and nicotine in Massachusetts is already 21. There's no need for this policy. It's simply wrong to remove adult choice for tobacco and nicotine products when we live in a society that values allowing adult consumers to choose addictive practices and substances, such as alcohol, marijuana, and gambling. I think we all know people in our lives who have quit addictive practices, such as those mentioned, as well as tobacco and nicotine. Making choices is an important part of life. So I ask you to reject this proposal and stand up against the stifling of free speech for adults. Thank you.
I don't have any questions for Emily, Steve, or John.
Nothing for me. Thank you, Emily.
Thank you.
Thanks, Emily.
Steve, no questions.
No questions.
Okay, thank you, Emily.
Next is Isabel.
Hi, my name is Isabel Tashi, and I'm a high school student and resident of Needham, and I go to Needham High School. I'm here to talk today in favor of nicotine-free generation. It was recently passed within my town of Needham, and I work closely with our town's Board of Health, and I'm happy to talk about the implementation of that or set you up with anybody who's willing to talk about that with you from Needham. I know Dover and Needham work pretty closely together. And I do value your time, so I'll be quick. But first, I'd love to read a letter from a Dover youth who isn't available to speak today, but she asked that I share a message on her behalf. And her name is Pippa Whiteley. And this was her message. She said, "Dear Dover Board of Health, I'm writing to you about an issue that's prevalent within my community."
Isabel, excuse me. There's something wrong with your audio. It's kind of, am I the only one that's having trouble?
Is it glitching?
Yes.
Did you say glitchy? Is that, yeah, it's glitchy or so. It's just, your voice is kind of warped.
Cutting in and out.
Cutting in and out.
Interesting. Is it better now or is it still doing it?
It's a little
think-
better now.
Yeah.
Okay, I can try again, and then if not, then I'll try to figure something else out.
Yeah, and why don't you go back a little bit in what you were saying? Because
Perfect. Yeah. So I'm from Needham. I go to Needham High School, and it's close saw nicotine-free generation pretty closely within my town. I was very excited to see it passed. I have a letter on behalf of a Dover High School student. She couldn't make it today, but her name is Pippa. And she said, "Dear Dover Board of Health, I'm writing to you about an issue that's prevalent within my community and has had a widespread negative impact on my peers. Yet it can be battled and prevented in the future by passing the nicotine-free generation policy. One of my closest friends who I've known for years recently started vaping. I've seen firsthand how quickly it has taken over her life, just because she thought it was cool. What started as a casual habit has quickly developed into an addiction. One that, though she's tried to quit, she doesn't fully understand the weight of her decisions and understand how addicted she is. She doesn't see how it's impacting her mentally or the friends around her. The problem doesn't lie within my friend. It's the fact that this story is so common with my generation. I've heard all sorts of stories about nicotine use and abuse starting all the way in middle school. You become sort of numb to them after a while. I didn't fully understand the extent that nicotine addiction impacts someone until it affected my close friend. There's a little bit more to her message, but I believe she emailed it to some Board of Health members, so I'll stop there just for the sake of time. But I'd like to say that Pippa's experience isn't unique. I've seen it within my high school. I've talked to other youths who see it within their high school. I have a particularly jarring story of a friend who started using nicotine pouches or Zyn pouches when we were in middle school because she'd always suffered from anxiety and she didn't have any coping mechanisms to help her with that and help her with her anxiety. She started using Zyn and nicotine pouches because they were labeled things like cool and chill. She thought they'd help with her anxiety. Instead, it's made her anxiety significantly worse and she can't stop using. A really sad moment for me was last year during our sophomore year of high school when she started crying during one of our classes. I asked her what was wrong, and she told me that she'd already gone to the bathroom once to use her vape because she'd started vaping too, which is pretty common. And I said, "Well, what's wrong? If you've already gone to the bathroom once, what's the problem?" And she said, "Well, I went to the bathroom so I could vape, and my teacher won't let me go to the bathroom again. And I need to use my vaping products again." And she couldn't go 15 minutes without using nicotine products in class, and it was bringing her to tears. I think that this story is not uncommon. I know so many youth who are either addicted to nicotine use or they have close friends who are often addicted to nicotine products. I would be surprised if there was a single person in high school, in Dover High School or Needham High School or surrounding towns that don't have the same problem, who don't know somebody who's severely addicted or addicted to the products themselves. Throughout my high school, all I heard were people praising the policy. People are scared. They're scared for themselves and they're scared for their friends. They've seen family members die and become addicted to nicotine and tobacco products. It's the leading cause of preventable death in the United States. There's no redeeming qualities to nicotine, and I hear a lot of conversation about choice, but nobody chooses to be addicted. I think that if we had choice, the choice would be to have freedom from nicotine addiction and from nicotine addiction and targeting. These companies target our most vulnerable groups of people, whether that's racial minorities, young people, or people struggling with mental health issues. I would like to ask you to highly consider the nicotine-free generation policy. And if you have any questions, I'm happy to answer those. And I'm also happy to send over some contact information from people from the Needham Public Health Department who've helped pass it. I'm not sure if I'm assuming you might already have some of that information just because I know Dover and Needham work closely together, but I'm happy to send it either way.
Thank you. I have a question for you. Are you aware of student groups, organized student groups at either high school that are interested in this topic?
Yeah, definitely. So there's a group at my high school called Salsa, and we're students advocating for life without substance abuse. And they've been really interested in nicotine and tobacco prevention. I know that there's also a similar club at Dover High School, and I can definitely reach out to them to see if they'd be willing to talk. I'm also on a statewide organization called the 84 Movement, and that's from the Massachusetts Department of Public Health. And we do a lot of really interesting kind of conversations about tobacco and nicotine, but specifically like unfair targeting practices. And there's a lot of adults who work in that who are very familiar with those policies. So I'm happy to have any of those groups get in touch with you or Dover's Board of Health, because I think that there's a lot of people who are much more educated about this than I am who'd love to speak, and also youth from Dover who would love to speak too. So I can definitely try to reach out to them.
Thank you. Steve or
Yeah,
John?
thank you.
Steve? No, you're on mute, Steve.
No comment.
Isabel, I want to thank you really for taking the time to be here, making a really clear presentation. You should be very proud of being willing to participate in a forum like this. So thank you very much. I don't have any questions, but I really appreciate you taking the time and also representing one of your friends from Delver who couldn't be here.
Yeah, thank you for listening to me. I know that you guys are very busy, so I appreciate it.
Thank you very much, Isabel.
Thanks, Isabel.
Okay, up next is Ginny Chadwick.
Chadwick. I am a PhD student at Brandeis University and been living in Somerville while getting my PhD, but Missouri is home for me. And I was actually on the Columbia, Missouri City Council and the bill sponsor for the Tobacco 21 policy. And we were one of the first places in the nation to pass it after all these little suburbs in Massachusetts were passing it. And so my eyes have been on Massachusetts for a really long time. That was back in 2014, watching the work that the boards of health get to do. In Columbia, Missouri, public health policy passes at the city council level. And Massachusetts is so special and unique that you guys have a dedicated body to pass health policy. I was able to work across the country helping communities pass Tobacco 21 policy. And what I'll say is that in all of those meetings, the convenience store associations, it didn't matter what state we were in, they were there with me. And they often said that this is a policy not worth considering, a policy we dreamed up, a solution to a problem that didn't exist. And that was for flavor policies. That was for Tobacco 21. It seems to be, unfortunately, for any tobacco control policy that we bring forward. But the problem does exist and we know it. We hear it from our youth. While we heard that nicotine rates are at an all-time low, that's actually inaccurate. Smoking rates are at an all-time low, thank goodness, as we know the most deadly product. But nicotine rates are not. They are at an all-time low for the last decade, but in 2019, we had more youth using nicotine products, more youth vaping than we did in the 1950s of all nicotine users. And so when we think about in this last decade, right now they're at a low for the decade, but unfortunately, we were really, really high at the beginning of this decade. So we have to think that our youth rates are still way above where we want them to be. And when we think about education and parent oversight, like I want to just bring awareness to the fact that the industry specifically targets our youth with these addictive products. And been in Somerville helping them with their policy. They did just adopt it. They gave a 60-day implementation period for just thinking about the questions that you guys were asking. I do want to acknowledge that the Truth Initiative did put out a report because one of the speakers said that the flavor policy in Massachusetts has not been effective. Truth Initiative report says that Massachusetts policy was the first to remove all flavored tobacco products, leading to an 86% decrease in overall e-cigarette use and a 98% reduction in the sales of flavored products. And while there is a illicit market in Massachusetts, Massachusetts isn't the state with the highest illicit market. Both New York, California, New Mexico even, which doesn't have a flavor ban, has a higher illicit market than Massachusetts. So New Mexico being at 41%, Massachusetts being at 39%. So I'm not saying that there's not an illicit market, but it's probably not just caused by the flavor policy. So I want to acknowledge that there's data out there that negates some of the things that we're hearing. We don't know of a retailer that's gone out of business for nicotine-free generation. And I always say when I'm working on tobacco control policy, if your business model depends on addicting kids to a deadly substance, we might want to reconsider our business model. Nicotine-free generation is about phasing out the legal sales, not controlling the individual's behavior. So I encourage you to consider it. Your work at the local level as a Board of Health in considering health policy moves policies like this across the country. Thank you.
Thank you for your comments. Do people have questions?
Nothing from me, but thank you, Jenny. I really appreciate your time.
Steve, questions?
No questions.
Next we have Maureen Busby.
Hi, this is Maureen Busby. I'm sorry, my camera isn't working right now. I hope you can hear me.
We can.
Oh, great. So I live in Melrose, Massachusetts. I am the Mystic Valley Tobacco Prevention Program Manager. I won't repeat everything I said in a previous meeting. I just want to mention two things. One, I was at the State House last week for the annual, we used to call it Kick Butts Day, but the youth organizers this year decided to change the name because butts doesn't mean anything to them. And they wanted something that reflected the products that they actually see and the products that their peers are addicted to. So the new name of that day on the Hill is Enough, End Nicotine Use for the Future. And we have an awards, among other things, we have an awards ceremony. And I had to stand the entire time because we had chairs for 240 people, but 300 people attended. And our good friend Isabel is too humble to mention that she's one of the organizers of that event. I had a chance that day to go with some of the youth groups to meet with their state legislators and listen to, it's a youth day, so I wasn't speaking, but youth were, and they talked about what's happening in their schools, why they're a member of 84, why they came to the State House, how strongly they feel about policies that will restrict youth access to these products. And I also want to mention, as an inspector, I take youth out on compliance checks. I know firsthand that most retailers are good, but many retailers are selling to our youth. And then I'll end with, I did send just a few minutes ago a photo of 3 products that I bought recently. In fact, the day before we went to Enough Day at the State House, I went to a local store and I purchased 3 new vape products. One looks just like a teddy bear. One, it's bright green. One looks like a small guitar, and one looks like a CD. And the packaging says, "Vape and play music wirelessly from your phone." I don't believe that these products, when I'm looking at them, I don't believe that they are targeted to a 40 or 50-year-old who's trying to quit smoking. The industry needs replacement customers. Smokers are literally dying off. These replacement customers are our youth, and that's why they're designing products like these, discreet, very clever, cool things that kids will try, and very high in nicotine content, which means it's easier for them to become addicted. Again, thank you for taking the time to listen to all of us. I appreciate having the opportunity to speak tonight.
Thank you, Maureen. I don't have any questions. John or Steve, do you?
Nothing right now. Thank you very much, Maureen. Really appreciate you coming out.
Up next is Kate Silba. Sorry if I mispronounced that.
Just quickly too, everyone, while Kate's getting set up here, Maureen mentioned sending pictures. She did send me an email, but there was nothing attached. So if you're still on, Maureen, if you don't mind sharing those again, because we would definitely love to see those pictures you're describing.
Is she still on, by the way?
Yes, Maureen is still here.
Okay, so she heard that. Good. All right, so Kate, go ahead.
Yeah, my name is Kate Silva, and I have spoken to you before, and I also will try to avoid just repeating myself. I did just want to give a couple of updates. Ginny did mention that Somerville has passed this and is on board. We just came out of a meeting with Natick, who is also moving it forward to drafting, based on the conversation we just had. We had some wonderful Natick high school students there. And the other couple of things I wanted to mention, one is, I just wanted to underscore that when Needham in 2013 became the first jurisdiction to adopt Tobacco 21, they went years where all the towns around them were still 18. And yet, within the first few years, they alone had cut their youth smoking in half, which is like miraculous numbers. And so when you make a decision like this, it is not simply contributing to a movement. It is also a decision for Dover, existing Dover middle school and high school students. I also just want to speak to a point that comes up a lot about adults and adult choice. And I just want to specifically say that there's so much research on the following point. You have to be an adolescent to start smoking. Only adolescents begin using nicotine. It is fundamentally a market dependent on adolescents. So north of 90% begin when they're teenagers, and then the remainder begin before they're 26, which, as you guys know, is still at the adolescent development brain. Somebody who can make an adult choice would not make this choice. And in fact, those that are dependent on the product, 2/3 of them would like to not be using the product, but they find themselves unable to. So when we hear about adult choice, it's just very important to understand the extent to which the industry is really dependent on adolescent decision-making. Without it, there are no nicotine users. They only initiate when they're adolescents. And then people talk about the fact that, since they initiate as teenagers and the current age is 21, how do we make sense of that as a sales point? And there really is an answer to that, which is that the research shows that youth under 21 obtain nicotine products from people inside their social networks. So they obtain them from someone a year, 2, 3 older than they are who can legally purchase the product. And the further they are from somebody in their network to whom the product can be sold, the less likely they are to access the product. So we're trying to, as gently as possible, achieve a state where teenagers just don't know someone who's in a position to provide them with the product. And from a retailer standpoint, we, as I'm in Brookline, we've had it in place for 4 years. No retailer has closed. And the reason is they don't lose a single existing customer, not one existing customer. When they come here as a convenience store retailers association or any other retail association, they're coming and asking for you to leave open a pathway to current teenagers, because everyone they are currently able to sell to can continue to be in that market. It's only people who are currently not using that they're asking you to keep open as a retail pipeline for them. And I would just say those people are adolescents, their brains are developing. It's not a substance like alcohol or cannabis. Not everybody uses alcohol or cannabis, is dependent upon it. The Surgeon General believes that nicotine is addictive more along the lines of heroin than alcohol or cannabis. And so I would just really encourage you to take the next step and hold a public hearing on this. And I think you're going to change the lives of teenagers in Dover. And I don't know what else a public health board could be happier doing. So thank you.
Thank you very much, Kate. Appreciate your comments. John and Steve, questions for her?
No, but thank you, Kate. Really appreciate you sharing your perspective on this. It's been very helpful.
Actually, I do have one quick question. Are there other municipalities you're aware of that are beginning to incubate this idea?
Why, yes. I'm happy to talk to you about them. The ones around Somerville, Belmont, Arlington, and Cambridge are all discussing it. Pittsfield is in discussion. As I said, we were at Natick earlier tonight. Amherst, Hopkinton is on the agenda next week. Northampton has been discussing it. Montague is on the list. So, you know, it's definitely bouncing around. Yes.
Thank you. Thanks again for joining us.
Okay, up next is Jonathan. Oh, Jonathan, if you'd like to speak as an attendee, you don't have to show your camera, so I'm just gonna allow you to talk if you wish to.
Oh, yeah, I can share. I'd like to share my camera. I just pressed the wrong button by accident.
No worries, I just promoted you to a panelist again if you want to.
Uh,
All
can
right.
you guys see me?
Can see you and hear you.
Oh, that's great. Okay, so I'm still at work, unfortunately. That's how it goes sometimes when you're dealing with children and adolescents. I'm at Mass General, I'm a pediatrician here. Thank you so much for allowing me to speak and weigh in on this. I've been working as a pediatrician here for the past 25 years. I've seen over about 50,000 child visits. I've treated many hundreds of young patients suffering from nicotine addiction, and it's negatively affected their brains. I urge your support of the nicotine-free generation. This will phase out the sale of tobacco products that keep innovating. They keep trying to get our youth addicted to nicotine. That's what this is about. I agree with our prior panelists on this point. And I regularly treat residents from all over Massachusetts in my clinical practice, including from Dover. I want to echo that the Surgeon General has compared the addictiveness of nicotine to heroin and cocaine. Few substances create such a strong withdrawal effect, rapid dependence, and tolerance like nicotine. It's a highly dangerous substance. Nicotine upregulates acetylcholine receptors in the nucleus accumbens and in the prefrontal cortex, and it's associated with compulsive use and reduced interest in non-drug rewards. So developing brains, they're uniquely susceptible to even low levels of nicotine, and exposure to nicotine in youth may lead to lasting brain changes. Nicotine itself is associated with worsening depression, anxiety, ADHD, and suicidal ideation. Nicotine exposure, particularly in adolescents, increases transcription of proteins that potentiate reward from other addictive substances such as cocaine, opioids, alcohol, methamphetamine, and accelerating addictive processes with these drugs, consistent with the gateway effect. The tobacco industry knows that people who use one starter nicotine product will then be much more likely to use other nicotine products, including cigarettes. And smoking itself causes 490,000 deaths in the United States each year. And the new tobacco product crisis among adolescents has reversed some of the important progress achieved over decades to get kids into adulthood tobacco-free. If a young person can make it to the age of 26 tobacco-free, the chance they will initiate after that age is incredibly small, less than 1%. So nicotine-free generation works at the local level. It decreases access to commercial tobacco products that addict people who have not yet started to use tobacco. And in this way, it preserves the freedom of the next generation who is not yet addicted from losing their agency over this addictive substance. And it works even when other surrounding cities and towns in your community take longer to enact the policy. I did some of that research in Needham that showed that despite the fact that every single town around them didn't do the policy, Needham's youth tobacco rate fell in half in the next 3 years, and nothing in public health works that well. So this is a tremendous support for your young people in Dover. Other products, this is nothing new to take a dangerous product and phase it out, like lead paint, asbestos. Those have been banned to protect public health. And this is not even an immediate ban. It's a gradual phase out of a highly addictive and harmful product in the commercial marketplace. We are not, this product is still going to be available. Nicotine is still going to be available, but it's going to be in the FDA regulated form. That will still be available for sale in pharmacy or over the counter through the Massachusetts Quit line and for free by prescription to help everyone who wants to cut down or quit attempt stop using the tobacco industry products, which are the ones that are killing people. So we're talking about putting it into a safe form. And in conclusion, tobacco has caused the greatest health detriment of any consumer product in history, causing more annual deaths than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. Tobacco causes more deaths each year in the United States than the number of US soldiers who died in all of World War II. It does not take, and nicotine-free generation doesn't take away personal rights or freedoms. It phases out the sale of a dangerous and addictive product over years. It's actually all about protecting the next generation and all future generations from the known harms caused by the impact of nicotine dependence on the mental, physical, and financial health of our population and our communities. The value of this freedom from tobacco dependence will honestly be immeasurable. So we hope that you'll support this version of the future and vote to support a nicotine-free generation when the time comes. Thank you very much.
Thank you, Jonathan, for attending our meeting and for your words. I don't have questions. John or Steve, do you?
No, but I really appreciate you taking time out of your busy work schedule to come here, Jonathan. It's tremendously appreciated.
Well, I know that you guys are basically volunteers, and I appreciate what you do every day. So thank you. We're all on the same team here.
Thank you again.
Bye-bye.
Bye-bye. Oh, Jonathan, what town do you live in? Oh, he's probably gone.
He's still on.
Maybe you could just put it in the chat.
Yeah.
Oh, he's coming back in.
Yeah.
yes.
Hey, folks. Hi. I too am named Jonathan. I know Stephen and Emily well from our work on allowing people to have, a right to tobacco and other nicotine products, and that's something I feel very strongly about. I mean, there's really never been anything worse for people's mental health than decaf and nicotine patches, and I mean, I just think that I feel like it's discrimination to tell a certain group of over 21-year-olds that they'll never be able to purchase tobacco in their own hometown. And, I'm really not thrilled with the non-smoking movement. I'm much healthier when I smoke tobacco. I firmly believe that people should have other health habits. I mean, black coffee and tobacco cigarettes have no calories. They help you to focus. Smoke breaks make us better, honest workers. There's all kinds of people, chefs, cooks, whatever, who really depend on a smoke break to do a good job. I don't think people could do homework as well if they don't have a cigarette break while doing their studies. I know you folks will probably vote up nicotine-free generation, but I think it's a bad decision, and I hope you'll change your opinion. And I mean, even in World War II, it was the Third Reich who put up the worst of like the racial purity non-smoking billboards. Well, the U.S. troops were well supplied with tobacco, and it made them good allies. It saved our futures. And I really don't see it any other way. I mean, artificial nicotine products are anxiety provoking and not particularly helpful for focus. And, I mean, if you really want to help people, you should help other areas of health. If you could say, I understand that you drink coffee, but how about a nice black coffee with all the cream and sugar? I'd also would recommend, eating vegetables is an important part of staying healthy, outdoors exercise and hydrating. I think so too. And I think smoking is a healthy way to focus, and people need better help with, their access to what helps with health. I mean, whether it's purchasing vegetables at the supermarket or drinking more water, I agree. But there's never been anything worse for my anxiety than non-smoking was. And I won't go back to non-smoking. And I really don't like if somebody's 21 years old and they will be not able to purchase tobacco, at a reasonably law-abiding store just down the street. I think that's discrimination. I mean, if you want to not smoke, that's your decision, but please don't push these rules on us. And I'm from Quincy, Mass, and I think you probably will vote out nicotine-free generation, but I strongly disagree. I think there are a lot of companies that are unethical that push non-smoking, and I'd rather you try to avoid listening to them. So thanks. That's it.
Thank you for joining us and sharing your thoughts.
Yeah, thank you, Jonathan. Really appreciate it.
Okay, should we
It
move?
looks like the other Jonathan may have come back. Suzanne.
It's hard to tell.
Well, there's a hand up. And it's lowercase Jonathan instead of uppercase Jonathan.
Okay, all right.
Oh, I'm sorry. This is the other Jonathan. I heard that you needed to know where I'm from.
We don't need
was-
to. I'm just curious.
Oh yeah. So I was in Somerville for a number of years, and then I moved over to Brookline. But I have to say, I love Dover. One of my favorite parts of the state. So I have a soft spot for the town of Dover. I used to go to the Dover Country Store. Actually, I don't know if how long ago that went out of business. You remember that?
I certainly do.
I love that place. All right.
Sorry.
Have a nice day, guys.
Thank you.
Thank you.
Bye-bye.
All right, nobody else has their hands up.
Okay.
Oh,
Wait.
actually, we do have one more hand up from Stephen Helfer.
That's okay. That's a repeat, so it's up to you. If you want to take someone a second time.
I think if he wants to speak for, say, just 1 minute, that would be okay. Stephen Helfer, can you just limit your comments to 1 minute, please? And you're muted.
You are on mute.
Thank you very much. I think this idea of agency is being oversold. According to the CDC, 2 out of every 3 people who have started smoking have quit. And that's why the smoking rate in the United States is now about 11%, where it was about almost 40% 30 years ago. And I think everybody on the board, my guess is, probably knows 2 or 3 people at least who quit smoking. And when they quit smoking, they were not writhing on the ground. I don't think they missed a day of work. They did not go to detox centers, etc. So nicotine does not rob people of their agency. It's a habit that's difficult to stop, but it's not something that steals people's willpower. Thank you.
Thank you. Are we done with comments? Looks as if no hands are up. Is that right, Suzanne?
That's correct.
Okay, so we're done with the comment period. Let's discuss among ourselves. What are you all thinking?
Kay, if I may, I know
Yes, sir.
Gail has some materials prepared for us just on this tobacco topic. She's been doing a lot of sleuth work since our last meeting, so I was hoping she could share her findings with the group before we get too far into it.
Just briefly, the last meeting, I was asked to interview towns that had deferred or declined to go with the nicotine-free generation, and those towns that had passed it. The town of Peabody, and you might have seen this write-up, has 42 vendors that sell nicotine products. and the Board of Health worked closely with the vendors to gain what they describe as enhanced compliance with the existing law. In the communication, I'm going to just read off to you. We'd like to start off with a thank you for allowing us the opportunity to work with you on presenting our knowledge and resources that we're going to use within our stores to maintain the safety of our youth, along with our new operational guidelines that we are willing to follow. We look forward to our continued positive relationship for us in the community. The plan and how we propose to put these necessary guidelines into place to ensure compliance with the existing Massachusetts law regarding tobacco and electronic nicotine delivery products in Peabody stores. Currently, the retailers are in process of obtaining sign-on from the permit holders. Currently, half of the 42 tobacco permit holders in Peabody have signed on, and they will be evaluated and audited by the Board of Health. And I think there is an example of that audit tool that they're going to use to evaluate the effectiveness of this agreement. But the impression I got from speaking with the Peabody board, they were very thoughtful, contemplating, and really felt that engagement with the vendors around the existing law was a win for the community. The other community I spoke with, which you heard from earlier, was Brookline too, that worked closely with physicians and a gentleman, Anthony Ishak, who's been involved with surrounding towns in moving that initiative forward. But Brookline's stance on it was education for the community. And because they do have a lot of medical professionals that live in that community, it was important to pass the initiative.
And did they develop an educational campaign around the initiative? Do you know?
Brookline?
Yeah, Brookline.
Yeah, they did a lot of marketing.
Uh-huh.
A lot of marketing.
And did they engage their select board in Brookline, or how did they actually carry out implementing the policy?
I believe it was through the Board of Health. She did not mention Segal is the director in Brookline. She did not mention if the selectmen were involved. It did take 3 nights of town meeting to get consensus on it.
And why did it go to town meeting? Do you know?
I don't know.
So for us, that would not be the case because tobacco regulation lies, the responsibility for tobacco regulation lies with the Board of Health. Does anyone, Jason, do you have any idea why it would have gone to town meeting?
My only guess would be they enacted it as a bylaw as opposed to a regulation. I'm not quite sure what the difference would be, just in terms of actually implementing it, but bylaw obviously has to go to town meeting. Regulation we could just do with following along our process, hearing, vote, all those things. So yeah, I'm not quite sure the different procedures these different towns have followed with this.
It sounds as if that might be one question for us to pursue. If we want to do this, is it sufficient for the Board of Health to pass a regulation, or is a bylaw necessary?
Yeah, it would also really, it'd be interesting to hear the perspective from the select board or maybe town council about what the process is we should use if we were to move forward with this.
Yeah.
I was
Steve?
surprised when Natick came up in the discussion because I had spoken with Mike Boudreau, who's the director, in mid-March. And at that point, he had indicated they were not progressing. They were not going to take that initiative any further. So I'm curious what changed.
Yeah.
Yeah, it'd be interesting to hear, Gail, if you learn anything. So Steve has his hand up.
I'm still concerned with the lack of local input regarding this issue. I don't think any of our speakers were residents of our town. I've spoken to very few people about this, and it's an issue where people that I usually speak with are strong about a variety of other opinions, but in this issue, they're pretty apathetic. I think if we're going to move forward at all with this issue, I would certainly want to have an open hearing before moving ahead, because we just don't know what the tenor of the town is regarding this. And I would really want to have at least that sense before deciding on the issue.
I would feel particularly that way about youth, about having younger people weighing in on this, not just school-age kids, but young adults, late adolescents, you might call them, or young adults.
Our 2 tobacco license holders were invited to this meeting, just for the record. But as far as I know, none of the speakers were any representatives of those establishments. So, and amongst the, I don't know, 25 or so emails we received as a board, I think there was maybe only one that was a Dover resident. The rest have all been from some of these outside agencies. So.
I just want to comment, I have been engaged with the school nurses at the elementary, middle school, and high school level. So I could ask, particularly middle school and high school, of students that they know that are engaged in this that might be useful to talk to.
I think that's a great idea.
Yeah, my own personal feeling is, with all due respect to the people who raised issues about personal choice, I do think this is the right public health decision to make. And we've heard a lot of analogies. I could think about seatbelt use or anything, any other public health intervention that it has the potential to reduce mortality and morbidity. But, I agree with Steve that this is not a decision we want to make today. I think if we really want to look at this, we do need to schedule a time, have an open hearing, and really get people from the town to come and share their feelings and perspectives.
I agree. And we also need to, as we talked about a few minutes ago, hash out the legal questions, how we would proceed.
If this were to be adopted.
Yes. And I would also like to learn more about what Needham and Brookline and perhaps other communities have done in terms of educating people after adopting the policy.
I just want to mention real quick, Kay, because I don't want her comments to go unanswered. Kate, who spoke earlier, submitted a few comments to us. Brookline is not a board of health; it's an advisory committee. So that's the rationale behind going to town meeting to pass this.
I see.
Regulation. So thank you for that, Kate. Sorry to interrupt you, Kay.
Oh, that's very helpful. So that implies that it's perfectly appropriate for a Board of Health then to consider this as a regulatory change. Good. Well, I won't go through my notes right now, but I made some notes about other questions that I think would be useful to answer before we come to the point of a hearing. I certainly agree with John that I think that this is the right move from a public health perspective for many reasons, but I do think we have some work to do before we conduct a hearing and make a final decision about what we're going to do. So what if we were to maybe all funnel our thoughts about what we want to do at this point, not in terms of a decision, but in terms of gathering further information to Jason, and then he and Gail, or send your thoughts to Gail as well, maybe to both of them, and then they can do the legwork needed to get us the information we need, and then depending on how long that takes, we could put this on the agenda for, I would guess, a couple of months from now, something like that. Or do we want to go further in the summer? I don't know. What do you all think?
I think that's a good suggestion, Kay. If we can forward comments to Jason, get some answers back, maybe discuss it at the next Board of Health meeting. Yeah, I think we have a lot of open questions. Kate Silbao added some more comments. She said that town meeting in Brookline runs 3 nights. The debate was only half an hour, and she was the co-sponsor. So, it wasn't such a long meeting there. But yeah, I think before we do anything, we really want to hear from the town.
So we do more homework at our next meeting, assuming we've gotten a good amount of that done. We talk more and make a decision about whether we will then schedule a hearing at the subsequent meeting. Does that make sense?
Sounds like a good plan.
Steve?
Sure.
So we'll each send our thoughts to Jason and Gail.
Well, thank you everyone who came and shared your perspective. And I feel I have to call out Isabel as a high school student for really, taking the initiative to get involved in town government and policy and health policy. So thank you all, and thank you, Isabel.
And Isabel, thank the Dover student Pippa,
Yes.
Pippa, right? And thank her for submitting her letter. And you might encourage her to reach out to us so that we could talk more with her. All right. Anything else on this subject? Gail, thank you for doing the research. And I like your idea of being in touch with the school nurses. I think that's a great way to proceed. Are we on to our next topic? Yes. Okay, let's just say, first of all, our next meeting is May 12th. Is that okay for everyone? All right. And then let's go to our minutes. We're already an hour and 10 minutes into this. I think the minutes will be quick, right? I mean, there aren't many grammatical changes to make to Suzanne's minutes. Very quick. I have just a few things I want to mention about the minutes. How about other people?
Go ahead, Kay.
All right, I'll go for it. On what I think is page 5 in the PFAS section, the paragraph begins, member Quackenbush recalls the 2022 PFAS testing program. The last sentence, I thought it was only one of those properties that had a high level. I'm pretty sure. And I'm not certain they've been resampled. So if there's any question about the accuracy of that sentence, I think we should just delete the sentence.
I can take that out, sure.
Anybody object to taking that sentence out?
No.
Okay. Then on the next page, page 6, I'm almost embarrassed to be this nitpicky, but the last, second to last sentence before bird flu is, it says duck or aquatic bird. A duck is an aquatic bird.
That's a good point you make.
Just
Of an aquatic bird. How does that?
Yes, of an aquatic bird. All right. All right, then.
It's also a verb.
In Boston, ducks aren't just aquatic birds. They're also tourist a tourist.
Seriously?
The duck boats.
Oh, the duck boats. Oh, all right. All right, now the next section, bird flu topic, beginning of second paragraph. So MAVEN is an acronym, so it's all caps.
Okay.
So, and then Member Kruskal observes that people now receive DT boosters. I think that sentence should be removed because it's not that I could nitpick the accuracy of it, and I think rather than correct it, I think we should just delete that sentence. Is that okay with it, Steve?
I don't have the minutes in front of me, but sure.
Okay. It has to do with why the switch was made in tetanus vaccination and the acellular pertussis vaccine. I think we should just delete the sentence. And that's all I have. And Steve, I saw something highlighted in here that probably was your edit.
I submitted my comments to Suzanne and she's incorporated them already.
Okay, great. And John, you're okay with this?
I'm perfectly fine. Good catches, Kay. So thank you.
Especially the aquatic animals. Okay. All right. So can I hear a motion to accept the minutes? of
I
March?
move we accept the minutes from March.
Second,
All in favor, I, Kay Peterson.
Stephen Kruskal.
And I, John Quackenbush.
Next item is the Board of Health grant discussion. Jason.
Yeah, so I'll give a quick overview on this. So everyone on here may or may not be aware, but the town recently received a grant that would enable us to pursue online permitting. The total sum, I believe, was somewhere in the realm of $110,000. To my understanding, that was not the full amount that was requested, but still a good chunk to get us up and running with everything, just in terms of the permitting, the digitizing of files, all that stuff. So my thought on this, actually somewhat inspired by Steve, so thank you, Steve. So we have a grant within our own board that we received a few years ago, something to assist us in our own digitization of files, to the sum of about $60,000. We've just been sitting on those funds. So my thought kind of was, since the town as a whole is working towards this online permitting effort, why not pool all these funds together if possible? I'm not saying we have to do it that way exactly. It's just kind of one thought. I just kind of wanted to bounce it off of you guys and see what everyone thought, kind of just about this whole online permitting thing, and just kind of about these funds in general.
You know, personally, I think it makes a lot of sense to pool the small amount of money we have with what's in the town. Number one, I don't think $60,000 at this point is going to go far in getting us a system that's going to be functional. But I think more importantly, what we really want to see happen is to get whatever system we have in place integrated with all of the other permitting that happens here in town. The building inspector, our own inspections, all those pieces I really think should be part of the same integrated system. So I would be very supportive of just reaching out the town administrator and suggesting they pull the funds.
Steve, do you have thoughts?
That was my suggestion.
Yep.
Anything to add to what's been said?
Only that I don't have 100% confidence that the town will move ahead with alacrity, regardless.
Yeah, I mean, there are a lot of fish to fry here in town, but hopefully this is something that will be implemented. It seems like a win for everybody.
So I have a question, which is, are we certain that the grant, not the grant, are we certain that the software sorry, let me back up, that the budget that town is allocating for the software includes the cost of digitizing our files. Because if it doesn't, then we could end up not having enough resources to get everything digitized. But I would assume that it does, but we could find that out, and we could, because we were given the grant. I don't know. I actually don't know the circumstances of the grant, except that Denise Garlick had something to do with it and Jerry had a lot to do with it, right, Steve? And
Yes.
was it for digitizing files, or was it for buying a system, a software system?
My understanding was it was a system that allowed us to do both, which I suppose back then $60,000 went a lot further in that direction.
Yeah.
I would still hope that we would be able to do both with the combined money, and but we certainly need the assurance that, at least as far as online permitting goes, that would be an absolute requirement for our participation with our money.
Well, I also feel as if, maybe I'm wrong in this, but that given that it was allocated to us by Denise Garlick for that purpose, that it shouldn't be used for anything else, that would be highly inappropriate. So,
Well, then there's this town, so this needs to be watched closely.
yeah. The other thing I would say is that I think there's a lot of support for online permitting right now, and that what I've understood is that the warrant committee is in favor of it, and that the idea was that if the grant didn't come to fruition, that the warrant committee is going to recommend that the town purchase the software anyway.
Well, I'm sure you have good information, so that's great.
Public meetings. And I can't help it over here.
It's about time, hopefully soon they'll replace the telegraph in town with telephones.
Well, it'll be really exciting. So, so therefore, does somebody want to make a proposal?
I propose we move forward with reaching out to the town to merge the grant funding that we received for digitizing Board of Health records with the grant that the town received to create a digital online permitting system, with the stipulation that the permitting through the Board of Health be integrated into that overall system.
Second.
All in favor? Aye, Kay Peterson.
Aye, John Quackenbush.
Aye, Stephen Prescott.
All right. All right, good. Alrighty. So next, animal inspector nominations. This is a Jason item.
Yeah, so this is done annually. Technically, these were due April 1st. So the paperwork already has been sent in. But I just, as a formality and to make it official, I wanted to bring it to an official vote before you guys. Jen Cronin has been our animal inspector for years at this point. I didn't know if anyone had any thoughts, or just seeking your guys' official stamp of approval on that. If anyone has any thoughts, or
I think that you folks are free to move forward with a motion to do just that, but I will tell you that I was markedly disappointed in her performance in one issue in the past, and it's hard for me to vote for her at this moment.
Have you discussed that with Jason, that concern?
He's aware of a bit of it, yes.
A bit of it, or enough of the issue to,
Yeah, enough of it. It's been discussed in the past.
So I move that we approve Jen Cronin's appointment as our animal inspector.
second. All in favor?
So
Aye.
go ahead, Kay.
Kay Peterson, aye.
John Quackenbush, aye.
Stephen Kruskall, no.
Steve, I would urge you, if you have other concerns, to speak to Jason about it more. Let's move on. Water testing and non-compliance, Jason.
Yeah, so this is kind of an oddball item. I just kind of wanted to put out the feelers to you guys and see what you thought. So if you recall, a few years back, right around when I first started, we didn't really have any procedures in place just as far as following up on water quality testing compliance and Title V inspections. And I'm just talking in terms of property transfer. Title V obviously needs to be done at the time of transfer with a few exceptions. And water quality testing needs to be done if you have a private well on your property. So what we've done over the last couple of years is we get a deed list every month from the assessor's office. And then we just go through it and kind of audit, see who's done what. And anyone who hasn't done any of those items, we send them a letter. Thought being, we never did any kind of follow up in the past. So at least if we instill this, it's some type of follow up. But now we've kind of reached a point where we've been doing that for a few years now. All we've done is send that initial letter. So now at this point, I'm kind of turning to you guys, since we've kind of discussed updating well regulations and those types of things. I'm just curious what your thoughts are, if any, on how we want to enforce this going forward. Do we want to send official warning letters? Do we want to fine? It's up to you guys. I just kind of wanted to see what your just overall thoughts were on that.
And remind me, you may have said this and I tuned out, but who do we send the letter to now?
So we send letter to the property owner.
The new owner, not the seller.
Well, so what we do is we send it to the property in question. So like if somebody buys 1 Main Street, just as an example, regardless of who the property's being sold to or being bought from, the letter's being sent to 1 Main Street, with the idea being it's going to reach whoever the property owner is.
Yep.
And how is that addressed such that it gets to the new property owner?
It just says property owner. So we keep it kind of general.
And that's sent as a certified return receipt?
No, we just send a regular mail, because it's not an order letter per se. We only send certified if it's like an order letter, giving someone X amount of time to correct whatever that issue is.
And so what's in the content of the letter, Jason?
It more or less just says, we're aware of your recent property transaction. Be sure you've had both a Title V inspection as well as a water quality test done. If you've done it already, please disregard this letter. If not, please be aware that you may be subject to fines or any other legal penalties. So those.
Oh, go ahead, Steve.
Well, it's not just enough to say, be sure that you've done it. I think the results have to be reported. And secondly, there's a delay in how soon we find out that someone has had a transfer of property. Often, I'm told that 20% of the sales in this town are cash sales, and most of them get to the registry of deeds, but I've also been told that a few may not. So be that as it may, I think we've got to tighten this up some.
Seems like it's kind of risky to buy a house and not have it registered.
Well, there's a number of sales to absentee buyers in this town.
Yeah. But I would agree with you. This should be required before the property is transferred. I mean, if I bought a house and then discovered that the well did not meet standards, that'd be a huge, to address that would be a huge financial cost. It seems like the sale should be conditioned on somebody doing both the well inspection and the Title V inspection.
I think that you could require that of people, and especially the realtors involved, and sanction realtors if it doesn't transpire as part of this.
I will say overall it's a very high compliance rate, but there's definitely a few properties that have slipped through for sure.
What do they do in other towns, Jason?
Well, it kind of depends on what it is. If it's an issue where someone hasn't done a Title V, then you can kind of pursue them in the form of order letters, through the Title V code. But not every town has this requirement to test well water. As you guys are aware, not every town has a well regulation. So, it's really kind of, it's town dependent. So that's why my thought is, we could send warning letters. We could issue fines under our well regulation through our town bylaws. So there's a number of different routes to go. And I'm not suggesting either. I'm not saying we should go back necessarily to years past, but if we could definitively draw a line in the sand and say, from here on out, we're doing this or that. I guess that's kind of what I'm looking for, unless you guys feel differently.
And how many are we talking about? You said it's a distinct minority of cases. Can you give us a ballpark sense of how often you think there's a property that changes hands that doesn't, and we don't end up with a Title V or well report?
Good question. Every deed list we get month to month, there's maybe one or two properties that we flag for having not done something. And I will say too, if one of the properties does fall into that category, we typically get responses to our letters. But then there's the outliers who get the letter and just crickets after that. So a lot of these things too, in my experience, they do eventually come home to roost, if you will. Whether they try and get a building permit 2 years later or anything like that. So they do eventually come home to roost. It's only a matter of time. But no, it would be nice to get something a little bit more definitive in place and really just kind of police these things.
I think that's reasonable. Do you favor one strategy over another in terms of administrative ease or likelihood of getting results?
If I guess one start could be sending letters that are a little bit more personalized and direct, because the letter we send now is very general. Everyone gets a copy of the same letter. It's addressed to property owner. So it makes it a lot easier to disregard when it's not addressed to you specifically.
Yep.
If that makes sense.
Yes.
So maybe that's a start. Maybe just making these a little bit more personalized. And I guess one thing we could do when we update our well regs is to be more clear on penalties, rather than only put, it's a $300 fine or whatever the current language is in our well regulation. Steve?
Given the commissions are involved and the sales prices involved, $300 fines aren't going to cut it. I think if we really want to do something about this problem, the fines have to be considerably greater, maybe $5,000 range or even higher. I also think we should be educating the realtors whose commissions are 50 times that $5,000 potential fine about this issue, because I have very reliable information that 20% of the sales in this town are cash sales.
Jason, I'm not asking you who the realtors are, but is it, can you figure out from the deed list who the realtors have been on these sales and therefore which properties were sold without a realtor being involved?
You know, it's a good question, Kay. I don't know that it says it on the deed list, but it's fairly easy to just back check in the sense that I could plug in a property and I would see, you know, the Caldwell Banker listing or whatever it may be. So you can you can check to see who the agent is that way.
Yeah.
You're not going to find all the agents involved because some of this is really done sub rosa.
I mean, I believe you, Steve. If that's the case, I mean, we really have no way to. If there's things being done, you know, super under the table, if you will, we really have no way to check that. Unless the assessing office is privileged to some information that I'm not privy to. I don't know how you could go through and check those.
So are you saying that that some properties change hands, and I don't mean just going from an owner to a trust, but from one person to another without that being without the assessor's office finding out about it? And I mean, they have to, right? If a deed is registered,
right,
they have to find out. So
if the deed is registered, they do find out.
Yeah.
Some deeds may not be registered. Many of those deeds may not be registered immediately. And some of these things are flipped a second time before the deed is even registered.
Right.
Well, we can only do what we can do. I mean, and it seems to me that taking that deed list and working that and trying to figure out which properties we don't have information for about well or septic makes sense. And then I guess I would like to, the reason I asked about the realtors is that I wonder if some realtors are more likely to end up being involved with properties for which we don't get information, maybe because those realtors aren't being diligent or just don't know about what we want or whatever, and whether approaching those realtors in particular would make sense. And I also like the idea of sending a personalized letter. I'm not sure I'm in favor of an enormous fine at this point, but I think starting off with education of realtors and personalized letters makes sense, and then see where we get.
When it comes to real estate, $5,000 is not an enormous fine, given the sums involved.
I get your point, but I'm not sure we need to talk about any fine if we can get what we need by approaching realtors and by sending personalized letters. And we don't know, that may not work, but I would rather try that first than.
Yeah, it seems like a rational starting point.
As an interim step, Steve, and then we could talk about fines. That would be my perspective on this.
Yeah, and I mean, I get what Steve's saying. I would definitely have to find out too. I'm not sure how much we can legally fine at one time. Typically, the way it's done is each day constitutes a separate violation. So you may not be able to do thousands of dollars in one ticket, if you will, or citation. But it could certainly accumulate to large amounts over time, depending on the circumstances. So definitely something to look into. But no, I guess my larger point is before I got here, I mean, we were doing, to put it bluntly, we were doing nothing on this. This is not something that was being checked.
Yeah.
So when I got here, my thought was, okay, well, we're going to do these letters because that's at least something, and it's more than we were doing before. So now fast forward a few years, we're here. So now my thought is, let's turn this up a little bit and see what we can do with this. So if from here we just say we start to kick it up a little bit with the letters, then so be it. We can see what happens with those. But I guess my wish isn't to backtrack on these. I'd like to just say, you know, from this day forward, this is what we're going to do, and we're going to see how it goes. We can keep track of specific numbers and just kind of, you know, that way I can tell you guys, hey, it's our compliance rate is X percentage or that type of thing. So, yeah, just see where we go from here, I guess.
And maybe ultimately this will reduce the number of files we have that have nothing in them about a property's septic system or well. I mean, it's actually pretty frequent that you mention that you hear about some property and you just have no data about it at all.
Yeah, about once a week. Actually, Suzanne just made a file for us today. But yeah, it's rare, but it does happen.
All right. Do we need to vote on this or not?
I mean, it's up to you guys. I don't think so. Just
No.
kind of brainstorming more than anything else.
Yeah. Okay, well, you'll report back to us, Jason? I don't know
Yeah, next deed list we'll get, we'll start doing it a little differently than we have done, and we'll see how it goes.
Okay, good. So let's move on to Gail's report, our public health nurse.
So I am getting very busy, starting off tomorrow at the town's benefits fair. I'm partnering with a Needham Public Health Regional Nurse, offering hands-only CPR to interested staff that want to learn about it. It's a demonstration I saw in Needham where 12 community members of all ages showed up, interested in how to react in a situation when somebody goes down and offer assistance with hands-only CPR. It's not a certification course, though. I'm looking forward to that tomorrow. As I mentioned earlier, I am engaged with the school nurses. I went around and have been in the elementary, middle, and high school, met with all the nurses. And out of that, I have been consulted on a couple of cases to reach out to a family about a situation, public health situation, in getting engagement. So it's nice to have some anecdotes to share with you that public health can be that liaison to a family in a home explaining about an issue with updated health records. And just briefly to tell you, the situation was this was a student that didn't have a primary care pediatrician, had a vaccination record from Brazil. That was hard to decipher and up to date, but I was able to talk with the host family that she is living with, who also have a relationship with the girl's parents, and get her connected with the PCP. It's ongoing work, but it was a great example of collaboration with high school. The challenge in that case was the insurance, in finding a pediatrician that would accept the insurance, but it worked out. I am live on Maven, and I've used Maven, just some data that I can give you some comparisons. Flu was up in the first quarter of this year. For Dover, between January 1st and March 31st, 42 cases. Compared to a town like Westwood, and I met with the Westwood public health nurse, they had 125 cases for that same time period. So, and again, these are just cases that are reported through a doctor's office or a lab. It does not include self-testing. And the COVID numbers are smaller, just given the fact that people are now doing their own at-home testing, that's not data. But for those, there was one COVID case that I did reach out to a resident, an older resident, just to check in to see how they were feeling, and they appreciated the call. We were not aware that Dover had a public health nurse, and I was simply doing outreach, introducing myself as a resource. So I have met with the library staff who've been great about marketing public health, and I'm joining a meeting there at the end of the month with the Council on Aging, some education that's going on, I think, in preparation for the town meeting. I've met with a couple of residents at the library, at Dunkin' Donuts, and it's just been great getting out there and meeting people. I joined Jason on Saturday at the rabies clinic, met a lot of residents there too. I think the more I'm on the road, the better it is just to get out in the community. Some of the other stuff that's come up, I do work with a regional public health nurse. UMass has a program, and she's a resource for me, just as I'm getting into this job of cases I might want to run by her or scenarios. And she is based in Central Mass. I think at some point Jason and I have discussed about her joining a shared services meeting because she does support Needham also in the Charles River Health District. I think that's it.
Gail, in addition to reporting the absolute number of cases of particular illness in town, if we're comparing ourselves to other towns, we need to know case rates. It's hard to compare our population of 6,000 to a town that has 15 or 20,000 unless we know the case rate.
Yeah. I just, this was newer for me, pulling the reports out of Maven. I'm not sure. I guess a question for the board is, how valuable is this where so many testing options are available outside of a doctor's office or a lab? Is it still important that you want this data that's reported through Maven?
Certain illnesses, yes.
What do you mean, Steve?
Well, tuberculosis, measles, if that starts to be more of a problem. There are illnesses that can be transmissible between citizens, and they have major impact. And if we had a cluster, I think we ought to be doing something. Yeah,
definitely. We're also a highly vaccinated town for those two conditions that you referenced. There was one pertussis case that we had in February for a fully vaccinated student that even had a booster, but that was one case.
Yeah, and no vaccine is 100%
Right.
effective. So there is going to be that occasional case.
Yeah.
Are you quoting RFK Jr.?
You should also track vitamin A toxicity too.
Well, there are infinite numbers of opportunities to get involved in it. It must be overwhelming in a way. So many people, even though you live in town, there's so many people you don't know.
Sure.
So many things to think about, but it's just wonderful to see you out there meeting people, and
I'm enjoying it.
Yeah.
I am
Good.
enjoying it.
Not a job for an introvert.
No, definitely not.
I mean, I appreciate the report, but I think the more important question is probably, what do you see the challenges you're facing right now, and where do you see opportunities?
Serving the whole community. There are older citizens, there are families, there are young kids, there are schools. It's trying to have the approach for the whole community, not select groups, is really important. I try to keep that balanced as much as possible. Some groups, through the Council on Aging, families, through schools, through, but I think that's the challenge right now, just to keep the whole picture in mind. We have a vibrant town with a lot of families, a lot of people, you talk about real estate sales, people want to get into this town for the schools.
Yeah.
What will be interesting is to see how opportunities for engagement with people change when the new community center is open. I think it's hard to predict what effect that will have on all of us, but it may make it easier to engage with people.
I'm not shy. Dunkin' Donuts, the library. When I'm running on Claybrook Road trying to avoid traffic, but there are a lot of opportunities in the transfer station. I mean,
I would remind you that in some of these situations, you're not always conscious of the fact that you're on camera. One of the places that has heavy coverage of cameras is Dunkin' Donuts.
I don't think I understand the point.
I don't think it's an ideal meeting space for any sort of privilege exchange of information.
Oh, I am. Okay. But I just introducing myself to people.
I have a question. When does the Dover Days Fair happen? I can't remember if it's spring or fall. It used to be
It's usually in September.
It's September?
Yeah. I already know where you're going with this.
I'm not
The
going.
answer is yes. Yes, it's a good idea. We should.
She's going to be juggling flaming torches. I can't wait to see that.
Yeah, I mean, if you want to do like a dunk tank or something where one of the board members sits up there and someone tosses softballs to try and knock you guys into the tank, I think that would be good.
That would be really.
I think the fire department does that.
All right, guys, let's go on to old business. Gail,
Well,
thanks for the report and thanks for being here. And we look forward to working with you on many, many different issues over time. Old business.
I know Steve had one or two items, and not to put you on the spot, Steve, but if you'd like to discuss them, we certainly can.
In the interest of the fact that the hour is late, and they're not urgent.
Okay.
I'll defer.
No worries.
Thank you, Steve. All right. And John, we should offer you the opportunity to bring up any old business.
I'm fine. I had a chance to catch up with Jason today. I had a few questions for him about some of these notices he sent about problematic properties, but he filled me in and I really don't have any questions. So,
okay.
But thank you for your involvement in those two, Gail. I mean, I think trying to figure this out is really important. We've had a number of these in this past year, and I always feel like the individuals staying there are at risk for a variety of different reasons. So I think your involvement is really going to help us sort all these issues out.
Here, here. All right. I'd like to entertain a motion to adjourn.
So moved.
Seconded. And I want to say to Suzanne, I've enjoyed watching her type the minutes in real time.
You can see me struggle to find the adverb I want to use. Questions, asks.
But thanks for all your help.
Okay. Good night, everyone. Thank you for all your input.
Thanks for a really productive meeting, everybody.
Thank you.
Bye, everyone.
Bye, everyone. Thanks. Have a good night.
Bye. Have a good night, everyone.